So every individual is given birth to by a man and a woman, so both parents, all right? And they inherit a set of genes from each parent. So with regards to hemoglobin genotype, an individual can inherit the gene that determines adult hemoglobin from one parent and inherit another gene that determines adult hemoglobin from another parent, so which is AA. So their genotype will be AA. And then some individual may inherit A from one parent and C from another parent. We have their genotype will be AC, hemoglobin genotype will be AC. And then while some individual will inherit A from one parent, S from the other parent, it will be AS. So that also occurs when an individual inherits S from one parent, S from the other parent, it will be SS. And if they inherit C from one parent, C from the other parent, it will be CC. And then if they inherit S from one parent and C from the other parent, it will be SC. So you should know that AC exists. Most people are used to AA, AS, and SS. But you should know that AC exists, CC exists, and SC exists. So if someone ask someone what's your genotype, which actually means what's your hemoglobin genotype, they tell you I'm AC. Don't be dumbfounded, don't be surprised, all right? Or they will tell you they are CC or they are SC, don't be surprised. So, and all of this is actually the normal, all right? The normal one. Why we call it normal is because individual that has AA genotype, they live a normal life, they don't have any crisis, and they are not at risk of giving the gene that will determine sickle cell or abnormal hemoglobin to their offspring. So this is regarded as the normal. The AC and the AS, they are called carrier states, all right? This is because this individual, they live a normal life. So AC and AS, they live a normal life. But they are called carrier states because they carry this gene, either C or S, in them, and they're capable of giving their offspring or their children this abnormal gene, hemoglobin genotype gene. They are capable of giving it to their children. Well, this SS, CC, and SC, they are called the disease state. This is because this set of people, they have crisis recurrently. But the crisis varies, all right? So I will talk about it just to know that CC, the one C is better than S, all right? So if you CC is better than SC, and SC is better than SS, all right? So the more the S, the more the problem, all right? The one that contains CC has lesser health challenges. They develop crisis, but not as often and not as severe as SC. SC also develop crisis, but not as often and not as severe as SS. So this is the worst one. Okay, let me take it. This is the worst. How do you determine if two partners, if they get married and give birth to a child, they are at risk of having a child with the abnormal hemoglobin, the disease state, which is the SS, CC, or the SC? It is actually a simple method of determining that. Which is ask the question, does each partner has S in their genotype? That is one. Or does each partner have C in their genotype? That is another way. Or does one partner have S and the other partner have C in their genotype? If the answer to these three questions is yes, it means that they are at risk of having a child with the hemoglobin, abnormal hemoglobin, the disease state. All right? So once both partners have S in their genotype, it means they are at risk. If both partners have C in their genotype, it means they are at risk. And also, if one partner has S and one partner has C in their genotype, it means they are at risk. You can use the Punnett square, all right, or the crossing method. But the Punnett square is better for most people, all right, because the crossing method tends to be very confusing. So what does the Punnett square actually represent? You draw a square, then you draw two lines inside, vertical lines and 2 horizontal lines. So draw a square first, then draw 2 vertical lines inside and draw 2 horizontal lines inside. So what you will have will be something like this. All right. So take note, this first box in the square, don't write anything there. Do not insert any letter there. So this represents one parent. For instance, if one parent is AS for one parent, and the other parent or the other partner is AS. All right. So when you do the crossing, the children they can give birth to will be this to this will be AA. This to this will be AS. This to this, so these two come together, AS as well. Right, these two come together, this and this come together will be XS. You can see this marriage or between two partners that are AS and AS, they will likely have children that are either AA, AS, or SS. All right. Does it mean now that they have 4 children, that one will be AA, 2 will be AS, and 1 will be SS? The answer is no. All right. That is because each pregnancy, all right, is a probability of its own. So they can be very lucky that they may have 4 children, for instance, that all of them may be AA, and they can be lucky that all of them may be AS. And in some cases, they can be very unlucky that all the 4 children will be SS. That is because each pregnancy is a probability of its own. So don't be misconstrued or don't have the wrong understanding that, yes, since we cross it like this, that one child can be, out of 4 children, 1 will be SS and 3 will be, 1 will be AA and 2 will be AS. It is not like that. So in this case, you can see that this pattern does not have S in the genotype, but this one has S. So when you cross it, A to A will be AA, A to A again will be AA, A to S, there's this one now, to this will be AS, A to S will be AS. So you can see all their children, they are either normal, AA, or they are carrier, AS. No one will be SS. So kindly share this video with everyone you know so that they will have a better knowledge of what genotype, hemoglobin genotype is, and then they will also have a better understanding if they and their partner are compatible to go ahead to raise a healthy offspring or children with regards to their hemoglobin genotype. So do subscribe and also put your comment in the comment section. If you have any question, drop it in the comment section. I will do my due diligence to respond to it.